Culturally competent care is kind of hard to define, but I think I'll do my best. I think culturally competent care is providing care in a way that understands the total picture of the patient and his or her environment where he or she lives, his or her background, his racial, ethnic background, socioeconomic background. And it isn't making our own assumptions, but it's really talking to the patient and understanding who he or she is. Sometimes we get it wrong. I may think that I'm providing culturally competent care because I've made assumptions based upon demographics, but I really haven't gotten to know the patient, and I'm totally off the mark. But I think it's really understanding who the patient is and then figuring out the best way to communicate with that patient. How do we do it? What's my approach? Well, my approach is, one, to really try to spend a lot of the time in the office setting trying to get to know who the patient is on multiple levels. So, for example, many of my African American patients in Boston were not born here. They came as part of the Great Migration from the cities of the South. So as a way of getting to know them, I'll ask, where were you born? And they'll say, oh, I was born in Alabama. And then we have an immediate bond because I'm from Alabama, and we can talk about our shared experiences growing up in Alabama. And that gives me a way of relating to them in a way that I might not be able to relate to them if I didn't know that bit about that patient. But I can do the same thing with a patient who is of a totally different ethnic background. So I can talk to a white patient and say, where were you born? And if the patient's born in Alabama, then we can talk about Roll Tide, the University of Alabama football. And that gives me a way of relating to the patient and creating some ties that allow me to, I think, create a sense of trust that helps me to better communicate and better build a relationship, because I think so much of healthcare is really about building a relationship with that patient. We get it wrong if we assume, okay, this patient is from a low socioeconomic status, and automatically start dumbing down what we're saying. I think that gets it wrong. I think we have to get to know the patient, understand who he or she is, understand how do I best communicate with this patient, and what's the best way of really building a relationship with the patient and understanding who they are that allows effective communication. To me, that's what being culturally competent is.